Is everybody ready? Hopefully you enjoyed your lunch. Now we're going to get into some actual case studies again. I'm going to use 2 or 3 different case studies to give you some insight into testing. This concept here, which is please don't make promises, but always give your patients slash clients, some hope. That's the whole concept of trying to help people the best you actually can. Case study number 2, this is Ann. A midlife female, came in with multiple diagnoses, various complaints. She had a huge list for us. Had been given no direction from her physicians or any other support group. On multiple medications, again with no direction. Very little direction. No fault of pharmacists in today's world, but it's often a confusing signal when too many times we're using mail-order pharmacies as the first line, where we get very little care coming out of that side. The big thing that we noticed with Ann is she had almost given up. She had no hope. And her most recent diagnosis was osteoporosis, not osteopenia, osteoporosis, which was a severe bone loss. That scared her because the doctors scared her into the fact that she said, you run the risk factors here are falls, bone breaks, etc. This is very difficult to see. This is our gathering tool that we use. I'm just going to go through some of this. Please list any major surgeries you have. Okay, if we look at this. Appendectomy, tendon repair, or you can go down, venous closure, carpal tunnel surgery, heart cath, partial hysterectomy, diagnosed with hypertension, high cholesterol, a carotid issue, gastroesophageal research, hiatal hernia, herpes simplex number 1, and the list goes on. Osteoporosis, thrombophilia. Do you see why she was depressed? Notice what her profession was. A registered nurse who had given up hope. 55 years old. Just looked right outside of Pittsburgh. And the intriguing thing, now I blacked it out just for the sake of being anonymous here. She left the weight thing, put a number in there, but see where it says desired weight? She didn't give me one. So obviously when you see that, the concept of she's been at a certain weight for a certain period of time, she was not morbidly obese but overweight, but overall, 2 children, she was fully content with the weight she was at. Letter I got from her. Dear Lynn, I have a telephone appointment with you on Monday, August 8th at 5 p.m. I would like to briefly update you with my progress. First of all, my GERD has improved by 80%. 1 prep. Guess which one? GI Complete. I'm taking Zantac daily with the GI prep for relief. My blood pressure is decreased. I'm only taking 12.5 milligrams of Temolol daily. Is it the vitamin D that you put me on that's helping my pressure? Again, I'm not going into the full details of what I did with this woman, but we go on and on. It says, I'm taking the following supplements. Vitamin D, 5,000 IUs a day. GI prep. Homocysteine support. She called somebody on my staff, said it's okay to decrease the dose on that. Bone essentials, okay? Some folate, omega-3 fatty acids. I buy this from Trader Joe's. Even though we put her on something, see what I said? Right away, we went to Trader Joe's and got it. At this point, I am uncomfortable with taking bioidentical progesterone and DHEA. I have my cervix, and the research from my 2002 Women Health Survey is breast cancer and uterine cancer. Do you have research to back this? Notice again, as a nurse, having a partial hysterectomy, I wasn't the one that initiated the bioidentical hormones. I reassured her that it was an important part of her bone health with the progesterone. But her interpretation of this, she went back and looked up the Women's Health Initiative study that came out in 2002, and she said, I saw that it was increasing the risk of cancer. Estrogen, followed by progesterone, they said in the study, increased the risk factors over a 5-year period.
Hydroxyprogesterone acid.
Exactly. It was completely synthetic progesterone. And again, a nurse reinterpreting what the doctor had prescribed that I said was a very important part of this, decided she was going to stop this. My health issues currently is the senile osteoporosis, and I'm avoiding too much calcium. The doctors are unable to identify the cause. I've been to a nephrologist, endocrinologist, been seen by 2 doctors from the Cleveland Clinic, now scheduled on September 30th with endocrinology at the University Hospitals of Cleveland. I was told by all the above doctors that my osteoporosis must immediately be treated. They gave me 2 options, Forteo or Reclast. Forteo causes sarcoma in rats at high doses. Try to convince your patients as you give them hope that there's going to be a path laid out here to stay off the internet. If they have questions about things, and that's what this woman was doing, is that she sent me a letter. Reluctantly, I chose Reclast, which I had this past Monday. I had side effects of low-grade temp and body aches. All the doctors encouraged me to continue with my supplements. That's amazing. Lastly, this past month, I noticed I'm losing too much hair. 150, she counted how many hairs she's losing a day. I decreased my fish oil, and I'm losing less. Is there a corollary? This is a problem I had with this woman, is she was so distraught with her health and continually having problems that she questioned basically everything that I put her on initially. This is what I got from her Warren, Ohio physical exam. I'm not going to go through all this, but this is, again, asking the doctors for their reports so that I could have a full-fledged diagnosis of the physical exam when they saw the doctor, the assessment plan, again, by the doctor that actually saw this patient. This is really difficult to see, but the big issue here, and again, this is a copy of my actual notes. This goes back a number of years. She didn't tell me initially that she was on Prilosec. That's my scribble on there. Is that they had started her early on with Prilosec, which has such a strong link to osteoporosis. So when we looked at the results, we had to work, and when we put her on the GI support, we started to see that so that we could actually get her off of this and she could start accounting for her own mineral status. Now, we also did a homocysteine level which showed major elevation in homocysteine. Now, MTHFR was one of my notes. This is probably 8 years ago. At that point, doing MTHFR testing was about $4,000. Where now it's $70 to $80, somewhere in that range, to do from a tissue sample on the inside of the cheek or saliva. So again, even at that juncture, we tried to get it through our insurance, we couldn't get it. Again, I just wanted to show you, this is her DEXA scan, basically, that showed her, if you can look all the way up here, her spine was a minus 3.0, which put her right into that osteoporotic area. Hip was minus 2.5, so she was definitely there. And again, they charted it out. So again, some notes on there about what we were going to do as far as the plan goes. Patient demographics, just all kind of different issues that we got. This is another report on her, again, looking at a performance summary of calories burned, calories consumed, and basically trying to figure out whether or not we could do a balance point. And again, this is before all the watches that we could do. Looking at the number of steps she was doing a day, where we took her from 8,000 to over 10,000. Sleep duration, where we managed to improve that. Once again, here's a list of what we did. Vitamin D, GI support. We actually used some boron with her, some bone, fish oil, and biotin. Now down here we added a prep called OptiFuel, which again strengthens the heart muscle dramatically. Dear Len, I have a telephone appointment with you. I can't believe it's November and hope all's going well with you. First of all, I faxed my recent labs to you. 24-hour urine calcium has improved. The endocrinologist at Cleveland University told me to continue the supplements you prescribed and follow up in 6 months. Secondly, my GERD is decreased. I stopped the GI prep, homocysteine support, and the MTHFR temporarily for the past 2 weeks, and my GERD has improved. She questioned everything. I'm taking the following, she went on. Following concerns, osteoporosis, I'm still uncomfortable taking progesterone, but thank you for mailing the research article as I read the entire 11 pages. I did ask the 3 doctors for a script, but they would not prescribe. Remember, she came to me on a bioidentical with progesterone. I gave her the information. She talked with her doctors. The doctors agreed, you need to stop this. I sent all the paperwork in on progesterone being the bone trophic hormone, that at this juncture, with all this woman had going on, we needed to keep her on it. Coming back on the other side, after we started to see all these improvements, the doctor refused to prescribe it. So we had to go back to have it done at a compounding pharmacy on a topical cream after that. Hair loss improvement, continued follow out. Can stress be a cause? Endoscopy revealed a hiatal hernia. Can the supplements exacerbate the GERD? Blood pressure at work has increased. Again, thank you for your time and expertise. We move on a little bit further. GERD's improved 90%. I'm off the Prilosec and Zantac. My hair continues to fall out, but worse when I shampoo. My beautician, I stopped taking Pravastatin in May. Now all of a sudden, out of left field, without notifying me, we're on a statin drug. I believe the last time we spoke, that's okay with you. I have 3 blood clotting factors that I believe in the initial visit. Does the homocysteine support help with this? I'm taking the vitamin D. My blood pressure has been the very best since I've been on all of the products. My Cleveland Clinic doctor suggests I discontinue the atenolol 25. This will also help me retain calcium in my urine. I have a history of avoiding too much calcium. I drink 2 cups of coffee a day. Does that contribute to calcium loss? Thanks, Len. I have to travel to Columbus for the weekend. If the weather is too bad to return by Sunday, that's why I moved. Risk factor of going to Columbus with snow. You know, and as we go on. So how did we start with her? Registered nurse, no hope, multiple problems. I think you agree, when you look at that, her big deal was the bone health. She brought that up a number of times. Really super concerned there. Even though we had the hypertension issues, the cholesterol issues, homocysteine elevated, MTHFR problems, we went through a series of questions with her, and the biggest thing to learn out of that is stay off the internet. I did share results with the patient and the doctor via email. We went back and forth, even though she continually sent me handwritten and hand-typed letters. I asked for a patient journal so I could keep a little more track of things with her. And I told her, can this be any easier? Where can I turn for help? And again, no promises, but give hope. That woman right now is 67 years old. The osteoporosis has turned around completely and made a major change for her. Now, with all of the different things that are occurring there, oftentimes you can be, as a practitioner, completely overwhelmed. You got a nurse that's second guessing virtually every step of the way, and that gets to be a very common problem. Where do you turn? Now, this is something that I think is a handout that's back there that talks about all the support. Now, I'm going to talk to you about this on a supportive protocol. It's wellness events, private, all the different things that Jamie has put together as something to offer to you all. He's going to pass this out. But one of the things that you will learn, that if you're buying products from other companies, oftentimes they'll offer a webinar or something along the line. But it gets very difficult at times to get answers to questions. You've already met Tracy, who's a wealth of information. They have a number of people on staff. If you go on the website, you're going to see the supportive staff members that are part of a medical team that's a part of this are there for you. The problem that we get sometimes as practitioners is we will try to dig on our own and try to find the answers on our own. One of the lessons I've learned, and one of the important ones, is I get frustrated myself, and oftentimes I give up hope. And if I give up hope, it's very common that the patient senses that. Let me ask all of you a question. In your education part, number 1 on this list, Through the course of your learning to do your practice, how many of you have been practicing counseling now for between 0 and 5 years? It's relatively new. Anybody between 5 and 10 years? 10 years plus. Most people. How many of you had a mentor? I mean, a full-fledged mentor as you were learning? Not many of us. I'm going to have Jamie, I'm going to put you on the spot and have you just give a little bit, because I want to talk to you about mentoring and how Nutritional Frontiers can literally be a mentor to you as you go through this. Oftentimes what you'll see, and I'm going to give you a little piece here in a little bit, on some of the ideas that I've used and utilized to upgrade my clinics. My background is this. I started as a pharmacist. I worked for a company called Thrift Drug for almost 17 years, and then I went out on my own. I opened a medicine shop, and then I opened another one, and I opened another one. I had 3 pharmacies going simultaneously. And trying to work between all 3 got to be a nightmare. Eventually consolidated down to 1, which I had for 20 plus years. Then, because of a lot of different reasons, including an armed robbery, I decided I didn't want to be in pharmacy anymore. So I converted 2 of my offices into nutritional counseling facilities, where I put an out front where I had products, and I remodeled the back rooms into counseling centers. So I was working between 3 different offices, 2 in Pennsylvania and 1 in Atlanta. So I spent 2 weeks in Pittsburgh, 2 weeks in Atlanta, 2 weeks in Pittsburgh, 2 weeks in Atlanta. And during that course of time, trying to design offices that stayed similar but different, but having built a staff, trying to have support, is when I actually met Jamie. And it was at that juncture where I was spinning my wheels, trying to train individuals at each office to order products, put products in, do this. Since I was out of most of the offices for 50% of the time, and Jamie and I were discussing this last night, is you can't be everything all the time when you're out running an office. So it took a support staff of knowing when I was in Atlanta, taking care of business in Atlanta, that Jamie was in Pittsburgh, and his staff, and at that point it was Mike that was coming into our offices, gave us the support that was needed to help my staff answer questions, help them even with utilizing and making suggestions as far as specific products go. So I'm going to ask Jamie to talk a little bit about mentoring and this concept, because one of the reasons that I have shifted from all the different companies I had purchased products for over the years, and there's been a lot of them, and why I've taken my practices to the majority of what I utilize is now coming from Nutritional Frontiers. And the big word that I use continually is mentoring.
Thanks, Len, appreciate it. So I'll be real brief here. So just to give you a quick background, I worked as a ACSM, American College of Sports Medicine, personal trainer, as I tell all the kids that work for us. That was before the internet, right? And when the internet hit and we were selling sports nutrition, what it became was a price war. So I was really lucky to find Dr. Jeff Bland and the old school Metagenics team that was so focused on education. So Dr. Bland was one of my mentors, and one of my top clients at the time was Dr. James Weiner. And he goes all the way back to Price Pottinger and Hippocrates and the Gerson Institute. So those are my 2 main mentors, was Jeff Bland and Dr. Weiner. I went to go work for Dr. Weiner. What I realized is that different than selling to a GNC, their business is vitamins. Your business is patients or clients. And I said, wow, all the companies are selling you products, and now you got to figure out what to do with it. So the whole idea of Nutritional Frontiers when we started was, being that we both own wellness centers, it was to help you improve the patient outcome and increase the practice profits. And we identified, being that we own wellness centers, and Doc's Wellness Center, from the time I joined him, was doing maybe about $700,000 to we got to about $4 million in one wellness center. That's 3 chiropractors and a cash practice in Pittsburgh. And the reason we were able to do that was by implementing these 8 strategies. It all starts with education. Education for you, your staff, and your patients. I like to steal ideas, right? And one of them I stole from pharmaceutical industry was educate the patient. They play the commercials to the patient. They go in and ask the doctor the medication. So we have a complete system to help educate you, your staff, and your patients. Right now we have an event going on at Doc's Old Wellness Center in Pittsburgh. I have a whole team there, and we're there for 7 days. Me, Len, and his old partner Joe DiMario would do events every quarter, either at, we were talking last night, at the churches and at hotels, right? So you got to do events, and that's part of the program here. But helping you with purchasing, not just our products, but the right products for your practice, and having a system in order. Marketing, we have all the tools to help you market in-house, electronically, on your website. So these tools have been created for you. One of the best programs we have is our patient education program, which includes free samples. I'm not a big shopper, I'm more of a buyer, but once in a while my family drags me to Costco, and they got the coolest sampling program you can walk through there. Some of it's healthy, some of it's not, but if it tastes good, you almost feel obligated to buy it. And I'm not gonna call Tracy up here, but Tracy Coleman, my new friend back here, is a friend through a friend of mine that I grew up with, and I sent her a care package, and she sent me the coolest testimonial. And what product did you try?
Sleep time.
And
And all your creamy powders.
what did you think of the sleep time?
I love it. I used it for 8 days. I wish I had more, so I'll be ordering more.
We get the hint, right? Yeah, so the sleep time has been one of our top sampling programs out there, plus the Probzyme you guys tried at lunchtime. You know, we have the technology. That's not my forte, of course, or Len's. That's Tracy's. But she can help you everything from technology with doing a Zoom training to the webinars to helping you your website, everything. Facebook, emailing. You know, the biggest thing is these wellness events, because once you get a person healthy, what do? They tend to try and do it on their own, right? So the wellness events are the single best thing that we do to keep a patient as a client long term. We give them all these free things at the event. They can come in and get free testing, workshops, samples, smoothies, literature, one-on-one conversations, and a discount. All they need to do is buy enough product to last them to the next event once they're on the maintenance program. And the camaraderie from patient to patient is fantastic. That's probably the coolest thing about it. Last event I was at, I was talking to this guy about, he'd come in he had problems with his knee, and I started telling him about HA Plus to rebuild the joint. He said, oh, you're just trying to sell me on it. And some woman came by, she says, can I talk to him? I said, go ahead. 45 minutes later, he had 3 bottles of HA Plus. They had talked for the whole time, because she was saying, look, I've been here, I've been buying this product, you know, I need a knee replacement, now I don't, right? So the wellness events, they're re-energizing to us, you and your staff, and to the patients. We're talking to Dr. Shemish's team, and they're gonna start doing these again in the future, right? You may have done an open house before. Now it's time to do these consistently. And if you're down in Florida or Atlanta, Rashid can help you, we can help you out. The private label, is anyone private label here? You better raise your hand, Paulina. So Paulina's been with a whole new business. And how to go with the first order?
Amazing.
Yeah, it was a full team effort. She had some concepts, Rashid was helping her. I came in, I brought a master herbalist in, Tracy in, and boom, there you go. It was quick and fast, as they say in Pittsburgh, right? And then the last part is sales. It is a business, right? Too many times in natural healing, you know, we're such nice people that we want to help everyone and we want to do it for free. It's like any other business, right? It's got to be profitable. So if you're doing the right things for the right people, you'll improve patient outcomes and increase practice profits. Dr. Tracy and I did a full webinar series on this, and we also offer a one-on-one program, and I guess me and Dr. Baker are going to start this week, right? So I'm here to help you guys. Of course, it's a business. We all got to eat. But you can buy products from anywhere, and so can your patients. But where can you actually help implement nutrition in your business in their lives? You can't just sell products. They can buy that from anywhere. But you got to implement all these. And the nice thing is we've been working on these for 20 years. So we've done all the work for you and we can help you with it, okay? Any questions on this? All right, thanks folks, appreciate it.
Thank you, Jamie. Let's do another case study. Jacob, there's a picture of Jacob, 16-year-old male. Now, look at number one with his diagnosis he came to me with. Highly unusual in somebody that's not clinically obese, highly unusual in somebody that's not 65 or 70 years old. Diagnosed with sleep apnea, major gastro problems, OCD, depression, migraines, and according to his parents, lack of energy and focus. Where do you start? How do you start with somebody like this? Obviously, with the OCD diagnosis, we ended up working primarily with the parents at first. It was very difficult to get Jacob to come in. So we were working sort of behind the scenes with Jacob. And again, when you have these many issues going on, where do you start? Now remember, they called me the gut guy. Obviously, I'm starting with the major gastro problems. So when we look at it, what diagnosis did he have typically? This is the form the mother filled out. Jacob's been diagnosed with OCD. Jacob is very anxious. Jacob has been in chronic head pain since October 2011. His stomach's been an issue since 2011. He's had sleeping issues since 2011. Notice, much like what Tracy said, there seems to be this line. This was done in 2015, so 4 years ago. Jacob was 12. Going from puberty forward. He had exposures to a second viral infection, a flu shot, and a Gardasil shot within 2 weeks 4 years ago. Flu shot, Gardasil. Remember how they pushed that? Continually, parents revolted about giving it to somebody so young. This kid was 12. And notice how his health, you can draw this all the way down, recommended you because of your help with Jackson. Now again, this is a gal by the name of Gail Jackson who's become a very good friend. Her son was diagnosed with OCD at age 6, which I find really hard to believe. And we worked with him for about 1.5 years to get him back into a regular routine. And I mean, I actually did, this is one of the rare occasions where I actually did house calls because this young boy, as he was growing up, needed the reassurance from somebody that he wasn't getting from his parents. You see the name Alyssa here. I kept that on there because my office in Pittsburgh right now is in a medical complex with 5 clinical psychologists. There's me and 5 clinical psychologists that with every one of my patients, whether it be weight loss, whether it be gastro problems, whether it be fill in the blanks, I start them out with a visit to the psychologist. It's a little bit different. It can't be done by everybody, but it has worked dramatically for me so that I can deal with the medical end of this, but before I see them, I have a psychological eval done on each and every one of them. So Alyssa is the one that recommended the treatment for Jacob. We're looking for sound, proven remedies to decrease Jacob's issue. Sound, proven. I know that Jacob's diet's not the best. It's not that he's not interested in food. He does enjoy fruit or vegetables. I've been told to try elimination diets with Jacob, but find it hard to know what to feed him. I'm very interested in getting him to eat better and show him how it can change how he feels. We have yet to find over the past 2.5 years any doctor or practitioner that has really showed some concern or compassion toward our situation. Hope. Parents were bleeding here. Parents did not know what to do. Doctor to doctor to doctor. Another medication, and at age 16, they basically lost their son. Doctor sent this over. I wanted a gastro look, looking at his stomach. So he had an entire upper GI series done. And again, I'm not a gastroenterologist, so I'm not going to pretend to fully understand this, but I can look at this and get at least the report back of what I'm dealing with this major gastro problem with this particular patient. We happened to use Genova back then, where we did an entire food complex to find out what this child was responding to. And the intriguing thing, it just came up with eggs. Even though we thought he had a lot of food allergies, it was egg yolks and egg whites. That was the only thing that was just mild. He really wasn't responding to much. Now, this test was done, I will tell you, after a month's worth of treatment with GI Complete. Now, did that heal part of the gut to the point where the antibodies that were being formed weren't really necessarily accurate? Again, mild to almonds, didn't really have much. How are you going to decide where he's going from there? I managed to pull a copy from Giant Eagle Pharmacy of this kid's medications. An EpiPen, top of the list. This kid obviously was having allergic reactions to something on a regular basis. Mag citrate, lemon, soluble, chronic constipation, had him on mag citrate. Propylene glycol, again, using more of a binding to get as a laxative. Mag oxide. Now, just point of reference here. If a doctor's ever going to prescribe magnesium, which is what they did with this child, form means everything. As Tracy had told you about that Mag Complete and all the different forms of chelated forms of magnesium, this is what doctors prescribe most often, mag oxide. Has anyone ever seen another product in the market that is made from magnesium oxide? How about Barber's talc? You ever see talcum powder? It's mag oxide. Okay, it's a binding agent, actually. And when this form, at 400 milligrams, he was taking one at bedtime, it actually promoted constipation. So when the minute the doctor added that in, we went from having all kind of other GI issues to the point where we needed 2 laxatives to try to fix him. So we added 1, which forced us to add 2 more. But again, when you put a second set of eyes on something like this and you're able to go through this and you're able to see point number 4, they used amitriptyline, an old-fashioned tricyclic antidepressant with this child. Major side effect of 25 milligrams at his body weight, 1 tablet at bedtime to help him sleep. Chronic constipation. So we had chronic constipation, and then we added naproxen 500 for his migraines, which we further destroyed his stomach, which forced us into using Imitrex for the migraines, which took us again to a lower dose of amitriptyline, to Maxalt, mag oxide, and we went down the list, an anti-nausea med, and we kept going down the list. Even ketorolac, which is a rather intricate pain reliever, dexamethasone. So this kid was just sheet after sheet after sheet of pharmaceuticals at age 16. Tramadol, Fioricet, indomethacin, prednisone 20. And the list just kept going on. This kid was living on pharmaceuticals. Another page. Here's the sheet that the mothers filled out for me. 112 pounds, normal weight, didn't smoke, not a former smoker, had surgery for a hernia. After those slides we saw, they actually treated him for a hernia. Chronic daily migraines, mild obstructive sleep apnea syndrome, OCD, migraines. This is, again, another part of our nutritional assessment thing that we sent out. And he says, at 18 months, diagnosed with peanut, shellfish, allergies to pistachio, cashews, and that family. At 18 months, he was diagnosed with those kind of allergies. But you notice when we checked him now, the allergies just weren't there. We decided to move on and try to make this kid at least feel normal. So we did a neurotransmitter screening, which comes from urine. Pharmacy and Labs originally did this using stem cells, They used rabbit stem cells to actually analyze and become active as far as levels go. The intriguing thing on this, when you look at the results, is the normal range is out here, that out of all of his neurotransmitters, serotonin in particular, came in at a reference range that should have been over close to 200, came in at 68. So his serotonin, which was needed to fight the migraines, to make him feel normal, but when you look at the sum total of this, and when you look at OCD tendencies, if you study brain neurotransmitters, when you see serotonin low and epinephrine or adrenaline basically shot, he's producing virtually nil. You got to do something. So we also did a cortisol scan on him. Remember what I said about taking cortisol readings first thing in the morning, lunchtime, supper time, bedtime, and then using something to boost that. You can see where his cortisol screenings go, virtually nil all the way down. We did an estradiol level and a progesterone level on him as well. His testosterone came in at 73. Now for a 16-year-old, that number should well have been 250 to 300. The estradiol level was not substantially high, but there was obviously a hormonal thing going on with him. Interpretation. Patient slept for a total of this is again because of the sleep apnea, slept a total of 345 minutes in bed out of 434 minutes for a sleep efficiency of 80%. Consisted of 10%, and he went into this. No satisfactory results were obtained with CPAP titration. A trial of nasal bi-level recommended. So the doctors again were pushing toward this. Discharge after the GI issue, normal upper third of the esophagus, normal body of the stomach. Mucosal linings of the atrium was disturbed, normal duodenal bulb health. This is again a sheet that we did in 2015, a 7-day anti-inflammatory diet, some Boswellia. Doctor had him on Zoloft at that point, and we alternated the dose. We put him on some melatonin at bedtime, pumpkin protein, and dimethylglycine. Ask questions, listen to parent, listen to child, observe. Understand that most patients forget why they came to you in the first place. Give hope always. One of the points that I make oftentimes is a full note-taking of what the parents told me the first time. That's why we use that form. Because at various points, especially when the parents were dealing with this boy, when he starts to feel better, they're almost going to forget the whole reason they came in the first place. So if you do the right things and use the right preps, you can find yourself get to the point of getting things turned around. Now I'm going to make a comment here, then I think, Tracy, you're going to come up with some of the products again? I'm putting her on the spot again.
Why, yes, I will.
One of the ideas that I've always looked at as a pharmacist, coming from a biochemistry background, is, I'll give you a for instance. When I started working with kids with ADD and ADHD, I started working with a group of doctors at the University of Chicago that were investigating various natural remedies and natural preps. And we're working on specific form. One of those is called theanine. And they were starting to work with theanine research, a single entity for ADD and ADHD. And they used it at various tiers. They were doing it as an outpatient. And the intriguing thing when I followed their research piece is that they got mixed results initially. Then they started looking into levels. They were trying to ascertain levels of theanine that would be active. And when they got down to a particular brand of raw material called suntheanine, all of a sudden they got the response they were looking for. They could not balance, they couldn't get the response. When they started using that particular entity, suntheanine, registered trademarked raw material, it started to work. So I paid attention to that. Then I started looking for that. Now, when I was using various entities for patients that would come to me with questionable mammogram, and we'd do estrogen levels, and the estrogen levels were slightly high, and I needed to get a balance in their estrogen levels. Or I'd have a young girl with acne, that we would do some work on, and we find her testosterone levels exorbitantly high, converting that over to dihydrotestosterone, and we don't want to be on antibiotics the rest of our lives for acne. And I found the raw material for Dimpro, diindolylmethane, in a particular form that was the active form that actually worked. So we could actually utilize that in a low dose and get the results that I wanted to get that out of the system and help the body to excrete. You can look at each and every one of these ingredients. Just talk for a minute about ribose, that one in the upper right-hand corner. Ribose is, and again, you can look at the research work that was done. That was done at Ohio State University for congestive heart failure, patients with extremely low ejection fraction that were going into heart failure. You see that there's a brand new drug on the market called, I think, Entresto that just came out, which is 2 medications that have been on the market that they put together in one. One to take some of the load off the valves in the body, and the other is a blood pressure med. The hope there is that if I use something like this, take the pressure off the valves and take the pressure gradient down in the heart, that the heart could heal itself. They're getting about a 22 to 23% success with that drug. Now, you find somebody in those stages that are on a medication like that, and you say, I wonder if I can help you. And you pull the research work that was done on that form of ribose, and you said, if I dose this accordingly, I can actually take this up, and there's a lot of other preps that you could use, but that one in particular can be used, taken up rapidly by the heart muscle. And I've actually had, and I'll just tell you one quick story, I had a 68-year-old Vietnam vet in Pittsburgh that his passion was running, and he would take a group of the vets in the area, and he took them in and around. He met them, Jamie knows the area, Cranberry, Pennsylvania. They'd meet every Monday morning, they'd have breakfast together, and he'd take them out for a run around North Park Lake. And they did this for about a year, and he was trying to get all these guys in shape. And after about 6 months, there's a slight hill that goes around the lake, and he was going around the lake, started grabbing his chest, passed out, and these fellas took him to the close hospital, North Hills Passman Hospital, where he was diagnosed with heart failure. His ejection fraction was 19%. Okay, so A, they told him he'd never run again. B, number of different medications. C, he was having difficulty breathing. So we used ribose in a very high dose with him. And over the course of the next 6 months, his ejection fraction went from 19%, ideal 60. We took him back to 51% on his ejection fraction without any other medications. He's now back running. He's now organizing a lot more of the vets for exercise. And he has basically turned his heart muscle around. So there's power in that.
That's in the power field.
Amazing. So you can see that in a lot of different ways. Now, Tracy's going to talk to you about some of the other ingredients. And again, one of the reasons me and my practice have made the decision that at least 90% of the time, there are exceptions. There are a few things that Nutritional Frontiers doesn't carry yet. But the one thing that I'm working on from my perspective with Jamie is if there's something out there that I think is really cool and unique, I'm coming to Jamie, because I will tell you, Sleep Time, which ended up being his #1 prep, he'll tell you that a number of years ago I says, hey Jamie, I found this stuff, man. I've been taking this for 2 years, best sleep prep in the world. Let's get to the drawing board, and we did, right? We sat down and said, let's get this, and this, and this, and this. And Sleep Time was born. And very quickly became their #1 selling product. Yes, dear?
I think that was one thing, right, about the time about the sleep time. I had read an article about taurine and how that can impact sleep, and you guys have that in your sleep time.
And a lot of melatonin products don't have that.
So once again, and I'll open this up for all of you. If you find something that's out there that you say, hey, this is really a kick-butt product, I'd love to talk to you. Jamie would love to talk to you and say, is there another way to do it that can get you the similar results? Or if it is something that's very unique, I'd like to take it to the board at Nutritional Frontiers and say, maybe we can even do it better. So Jamie's been wide open, and he and I have talked many times about coming up with specific remedies and specific preps. Again, understanding the financial ramifications of committing certain amount of monies for the development of a product. It's tough to do, but Jamie's been willing to do it, and a lot of the products that are on the market right now with Jamie and Nutritional Frontiers come with that science behind it. And there's just, I can't even tell you, when you see that list of patented, research, trademark products, I'll tell you this right now, that form of ribose is probably 10 times more expensive than other forms. Yes, dear? Okay.
And Len, there's a few examples in this small group even. Jason Holland from Dr. Edwin Lee's office, we had some great input on our B complex a few years ago and helped make it the Super B complete with Dr. Lee and Jason's input. And of course, Paulina with the new organic herbal tinctures we worked on with her. So we're very open. So if you guys have ideas or concepts, you know, you all have my business card, and at some point we'll be doing some VIP dinners here to do some brainstorm and roundtable discussions.
Okay, with that, I'm going to give you back over to Tracy.
So the HA Plus capsules, obviously we have the BioCell type 2 collagen. You know, why does that matter? Well, this is, you know, your collagen, your hydrolonic acid, and your chondroitin sulfate all put together in a synergistic way, okay? And it basically enhances the absorption, because when you look at HA, you can't absorb it. It comes in too big a form. So when it says less than 30,000 Daltons, I mean, what's that mean to somebody like me? I don't know, right? So I had to go look it up. I'm like, what's that mean? Well, normally it's like, I don't know, a couple million Daltons that HA Plus comes in, and we really can't absorb it at levels over this. So what this BioCell technology did was break it down to a form that we could actually absorb. So that's really important. You can see HA supplements out on the market everywhere. It's like the big thing. But they don't really tell you in all transparency what level it's at and if it's able to be absorbed. So I thought, wow, that's kind of cool, right? Also the synergy of how these things work together in this patented delivery system. So you really do get the absolute effectiveness of this. And then we also have the HA Plus powder with the Hyamax. And in nature, you know, like I said, this is just a better way of delivery. Now what I noticed was when I did all my research on this, this actually targets joints more than the HA Plus in the capsule form. So the Hyamax is specific on cartilage and joints, where this product here, ladies, I'm telling you, skin, beautiful. So if you are looking, like you were saying, like how do you get the face to regenerate? Right here. Give this to your clients, patients that have issues with skin. It works very fast, quick and fast.
Hey Tracy, can I just make a comment?
You can make any comments you want.
Going back to the HA Plus capsules, the type 2 collagen that you see in there, again, very similar to what you see as bone broth extracts. If you look at type 2 collagen in the concept of autoimmune illnesses, and I've used this prep specifically. I have somebody with rheumatoid arthritis that's on a biological. They're suppressing their immune system, but they're still achy. They're still hurting. Or I have somebody with Hashimoto's, autoimmune attack of the thyroid. Any of those autoimmune issues, because this has this molecular weight, it hangs out in the small intestine, okay, in the gut, and it does an amazing job of tricking our immune system. Because in autoimmune issues, type 2 collagen at the right dose and the right molecular weight will deflect the attack from the body, not 100%, from our self-attack to the thyroid gland or to our joints to the gut. I've actually had my very first patient, a 16-year-old girl with juvenile rheumatoid arthritis, in a wheelchair. Okay, she's now 24, and she's a professional Christian singer. We used that specifically for her for 3 years, got her off her biological, got her joints back into a state of repair, and she's now moved on. So if you have somebody that has an autoimmune, especially with RA, amazing. You got to stick to it for a while. It's not going to happen in a month. You're not going to feel it in 2 months. But over the course of time, I use 2 twice a day for a loading dose. went down to 1 twice a day on a continuum over time. It started to deflect the immune system and calm down the RA factor. You can measure it in the blood. You'll see the RA factor starting to go down. But it's amazing how well that can work with autoimmune. Even for, you wouldn't think of using this for Hashimoto's,
Right.
but you could use it and actually calm down some of those thyroid markers.
There's also been studies on it with bladder infections, kidney. I mean, it's an amazing product. So look into it. And, you know, as a naturopath and even as a practitioner when I was in practice, you know, I really didn't look at the ingredients. It would say Immunomax, and I'd be like, oh, for immune system, great, boom, and I would give it to somebody. But then I had to actually figure it out, and something happened to my son that I'm going to share. That was the one thing that really helped clear him up.
Quick comment on the powder. That's actually one of the few powder joint builders that's vegetarian.
Right. Yeah, I was going to say there's no shellfish, right? It's just completely vegetarian. So you have those people that won't take something to build cartilage and collagen because they're vegetarian, or they have something that they can't take it because of the shellfish. This is a great alternative. So again, a little bit of something for everyone. So the creselazine and the X-Flame, this is a pretty amazing product too. I mean, you know, some inflammation is good. It's our body's warning sign. We want to have it, but chronic inflammation is when it becomes a problem. And the neat thing about this is that it actually works at the cell membrane level. It restores the integrity of the cell membrane, so there's less damage, there's less oxidative damage. It also is very alkaline. So the type that they use helps alkali the body. And when you're in stress, injury, emotional, whatever that looks like, you are actually going to be more acidic, which is going to impede digestive assimilation. I talked real fast about pH. Everyone understands pH is transit time of digestion. Every mineral has a pH and an enzymatic action it likes to be absorbed at. You go acid, you're not going to get your nutrients. So it doesn't matter how many supplements that you're taking. So this actually has an alkalizing effect. It also reduces some of the primary inflammatory triggers. So it's a pretty incredible product. And you can use this for everything. I mean, I've used it for people with poison ivy. I mean, you can use it for anything beyond muscle, pain, joint, anything that really is an inflammation in the body. Think of things where people come in and things are hot to touch or they hurt, right? You can use this product and it works pretty fast. Okay, so then this was the other protocol that I gave my pastor, which was this full spectrum hemp extract cream. He wasn't ready to take it internally. You know, he just didn't know much about it. You know, he was kind of like skeptical, has heard these things, and in all transparency, his testimony of how he became a pastor was because he was hooked on heroin for 9 years. So he was really apprehensive about taking anything, right? So long story short, he would do this. And so I gave it to him and he put it on topically, and obviously it has our lipoderm, which is our transdermal delivery system. It's what they use in pharmacology, and it just goes right in through the 3 layers of skin and can work very, very fast. I've also used this with clients that have migraines and headaches. Rub it right on your head. It works awesome.
Just another quick comment on this one. There's a
Make sure
boatload
you
of
like
CBD products out there. You'll see them at drugstores, you'll see them at gas stations. This is the only product I found that has the lipoderm delivery system. Most of those topical preps that are on the market out there just sit up on top of the skin.
Right.
So you'll find them use them and say, didn't really do anything. You know, it didn't really do anything. When we did compounding, that's what we used for our transdermal bioidentical hormones, because it made its way through the openings of the skin into the bloodstream very rapidly. So that managed to allow this to get into the areas where it needed to be able to reduce the inflammation quickly.
Yep, and I'll talk more about the CBD line that we have, our full spectrum hemp extract cream, which is our line in total. But like he said, this is kind of for that acute pain right there, and it gives relief within 3 to 5 minutes. I mean, people feel it instantly. So it's something that can be very solidifying for one of your patients or your clients that come in where they want something now, right? Give me something now. And when you sample this out, for somebody that has pain, their levels drop 10 to a 3, 10 to a 5, and that's big for someone that has chronic pain all the time, okay? So, all right, so this is my personal story. First, I'll start with my one client, Debbie. I don't have pictures of a lot of my clients because I didn't start the healthy selfies, which I have in here later. But Debbie came in with cracked everything. Like her face was all red, her fingers were cracked, her skin was just terrible. And she had sinus issues. So, immediately she walks in and I'm like, wow, your skin's terrible. You need fats, you need probiotics, we need to do a candida cleanse, right? I had all these things going on in my mind. But honestly, she was a McDonald's eater. Like she just, I had to start with foundations. And when I practiced, I was a foundation girl. I wasn't a this for that girl. But she was having issues with sinuses. So it just happened that week that Mikey G came in, he was my rep in PA, and he gave me this little thing called Air Max. And he said, go ahead and take this. It's going to open your airways so quick. And I thought, all right, I'll do it. So I was sitting there, and as we're going through our little, he would go through every new product, just like, Rashid comes in and does with you. I noticed that I could breathe easier, right? So I had this little Air Max product sample in my office. Didn't know if I was going to order it yet, and this new client comes in. So she's getting ready to leave. She wasn't sure what she was going to do. She was going to try to do better on her diet. And she's like, do you just have anything for my sinuses? And I was like, well, I just got this, but you can try it. So I gave her the sample. Didn't even think about it, right? She comes back, calls me in I don't know, it was maybe 5 or 6 days. I don't remember. But she said, all the cracks on my fingers are better. What was that? And I said, I don't know. It's this product called Air Max. Let me check it out. So I get on, and I'm looking at grapeseed extract, right? And when we look at all the benefits of grapeseed, obviously you can see here alleviates both allergic and inflammatory responses, blah, 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 blah. But basically overall, what it does is reduce oxidative stress. And so it was her bad diet and leaky gut and everything else, but it worked so fast for her. And because she was so skeptical of coming to see me anyway, this little product actually worked on her skin more than it worked on her sinuses. So I thought that was pretty amazing. And so she also had some secondary infections. Go ahead.
We'll just pass around some of the cream with the Lipoderm.
Oh yeah, go ahead.
Even if your hands don't hurt, you might be surprised.
Just rub it on your neck, guys. Just do it. Feels great on the neck. But she had some secondary infections, and I think, one of the things that makes this formula so unique are the tracks. These are our chelated forms of minerals. We really take time to look at these products, and I helped the zinc arginate chelate was one of the things that helped heal the secondary infection. So this little product actually works well for skin. So if you have skin issues, things that are oxidative stress, lymphatic issues, these can actually provide the proper protection against any of the free radicals. So it's just a different way to use it, something different to look at.
Psoriasis too?
Yeah, I will give it a whirl. Obviously, usually psoriasis, eczema comes with the secondary sinus issues, so it's going to have a twofer, you know what I mean? All right, as you've seen, we've kind of relabeled our full spectrum hemp extract oils. We are now USDA organic certified, and that basically means from picking to packing to shipping to your door, every process is organic. We don't use anything beyond 100% supercritical CO2 extraction methods. Do you guys understand the value of that, why that's really important? Right? You don't want to have any ethanol and sulfates. We also take that further distillation process to make it taste so good. There's no herbicides, there's no pesticides, and it tastes great. So now that you guys understand face, tongue, and nail, take a look at her. Okay? This was after she felt better. All right? She came in, anxiety and depression, she couldn't sleep, thyroid issues, and weight gain. Do you see how the kidney lines are showing under here? Very busy thinking. She has a huge heart. How far back her eyes are set. I don't look much better. I think I was really tired then. It was a hard time for me. I could have used this protocol. But she came in, she was a mess. And basically her job was, it was under, she was going to get fired because she couldn't focus. She kept getting in trouble at work. So obviously I went through this foundational reset. I talked about food, the 5 essentials, good fats, but I put her on Calm Day 2 a day, sleep time, and at the time, Thyro Complete. And she came back and she lost 18 pounds in 2 months. She was off all her anxiety meds, and her blood work was completely normal. In 2 months. Now this poor girl suffered for, I don't even know how long, and I've known Amanda since she was about 13. You know, obviously we worked with some changes with personality and behaviors. You know, saying no to people. She worked in a special needs home, which, you know, that's a very demanding job. So secondary protocol, after we got everything balanced, you know, Super B complete. We just kept going forward and forward with different, you know, nutrients that she would need. But what made it all so good? Now at the time I didn't have this full spectrum hemp extract. I wish I did. Have you guys seen this checklist? Okay, so everything here, every product that you use that's full spectrum hemp extract should abide by this. Grown in the USA, yep, single source from farm to bottle. That means one source of your hemp from one farm that's certified organic. If you're getting hemp from other places and they don't disclose this, that means they're gathering hemp extract from lots of different farms that may have chemicals and pesticides in it. Supercritical CO2, no chemical solvents, distilled, USDA organic, third-party independently tested. We do send our stuff out to get tested so that we know the potency and purity, and backed by a certificate of analysis. You can request these at any time on any of our products, any of them, okay? Wide range of delivery systems. Remember, that's important because you're going to have people like my pastor who just was not comfortable taking CBD, but he would do it topically. Okay, we also have the gummies, which work really well for the full family. And we also have the soft gels. Okay. All right, we're going to move into endocrine. I want to show you this picture. How many people do thermography? Okay, this is Erin. Do you see this pattern, this red speckled pattern? That's called an estrogen pattern, okay? She came in with infertility. She already had a daughter. I'm going to go back to the slides, guys. But she couldn't get pregnant again. So I like to tell people I get people pregnant because it just sounds weird. But this was her pattern, and it so happened that I had a thermography agency come in and contract with me once a month called Three Rivers. And this girl walked in, I knew her, I'd seen her a couple of times about healthy lifestyle, and she was doing really well, but she couldn't get pregnant. So I had her go back and just get a full body scan, and this came out. So she was on estro cleanse for 1 month. She came back, and this was her second scan, okay? So you see the difference of the green, and for people that don't know thermography, the red is where there's inflammation and coagulation. The green is what you really want. So this was 1 month. Now she had to stay on it for 3 months, plus Super B Complete, plus endocrine tincture. We did a few other things, but she ended up pregnant. So, and no miscarriage because, you know, we really took care of balancing those hormones. And that's the thing, staying on your supplements long enough, right? Estro Cleanse doesn't work in a month, it works over 3 months. So it's really important that you take that particular product over the course of 3 months or more and make sure you have some sort of measurement where you can say to the client, this was before and this was after. Thermography is a very powerful tool to show you estrogen patterns in the body, especially for males and females. If you have the opportunity, I would recommend you do it. Any questions so far? What we've done with our Estro Cleanse is the Isabi. Obviously, this is the ribosomes from pure wasabi, but it protects against bacteria, fungus, and it actually is proven to increase glutathione production. So why does that matter with high estrogen? Everyone know methylation, the end product of methylation is hormone production. If your methylation is poor, you will have poor hormone production. You'll have poor imbalances. Okay, so we'll crash course you real quick. How many people understand methylation? What did you do with the eraser?
Take shelf down.
Everybody know what methylation is? I know it's late, guys. Come on, pull sides waiting. If you guys say yes, I'll talk faster. Yes. All right, let's do a crash course. You ready? All right, so imagine you have a bicycle, 2 wheels. This is your B cycle. This is how your B vitamins convert. This is methionine. This is how your protein converts. So your person is eating food. This is not totally correct, so don't judge me on my pathways. Protein goes here, B vitamins here, hypothetically. This is where folic acid, if you have all the right methyl tetrahydrofolate reductase enzymes, right, gets converted to the right forms of methyl groups and B vitamins, and it crosses this little line. And guess who is the carrier? B12, methyl B12. He has to carry everybody across. And then those methyl groups bind with protein. They fall in love. And they create DNA, RNA, neurotransmitters. What are neurotransmitters for? Immune system and hormones, okay? So this is like your mood. How many mental health issues do we have today? Okay, so, and then we have hormones. Do we have hormone issues today? Okay, 40% of our society has this mutation of MTHFR, which means they cannot convert folic acid into folate, okay? So if you look at the ester cleanse, one of the byproducts, anybody work out in here? Right? What happens when you do a bicep curl? What do you get? Lactic acid. Is it a byproduct? Is it natural? What's your body do with it? Takes it, binds it with things like NAD and all that kind of stuff, throws it back in, right? And you go into the Krebs cycle, correct? So you make ATP and then it gets converted and all of a sudden you're doing cardio, right? 20 minutes or more. We call that Krebs, okay? The byproduct of this is homocysteine. So when you have high homocysteine, it's a marker for what? Heart disease, right? Okay. But some of that homocysteine then gets converted to what we call the most major antioxidant in the body, glutathione. Okay? Some of it goes back up here and some of it goes down there. Now, people that have the MTHFR mutation cannot convert homocysteine into glutathione because they do not have enough methyl body donors from this cycle. That's where, pull that cap, that's where Enter-DMG comes in. This little amazing product will give him of himself. He'll donate a methyl body. Okay? So this can be a very powerful add-in to any of your protocols, just to put DMG in there. Liquid, chewable, take it every day yourself. You'll notice more energy, mental clarity. It's an oxygenator. So when it comes to the ISABI, it's actually been shown to increase glutathione. So if somebody has high estrogen or hormonal imbalance, and hormones are the end of methylation, and you use the ester cleanse and it starts to help, what can you hypothesize? What's the next test you might send them for? MTHFR, see? And I'm not even that smart. So bioperine is next, right? This is thought to enhance the absorption of other nutrients. We know how well it works with turmeric. And then you have the curcumin, which is amazing. It increases or it decreases inflammation. So we thought all of these through simply because we want them to be the most effective. This also increases levels. Curcumin is an anti-inflammatory action and inhibits the formation of pro-inflammatory mediators, thromboxane and prostaglandin. When you have levels that are too high of prostaglandin, you have painful periods, dysmenorrhea, right? You'll skip or you'll have just such awful, awful pain. This works so good for teenage girls that have heavy, hard, painful periods, rather than running to the doctor and getting on birth control, which is what they do, okay? But again, you have to use it long enough. And then you can couple it with the endocrine tincture, and it's a great 1-2 punch.
So you won't use it with somebody on birth control?
Oh, yeah, absolutely.
You
Mhm.
can use it.
Oh, yeah. Yeah. Because birth control is a forced push. Remember, pharmaceuticals force the body to do something it can't. Nutrition rebuilds the pathway to do something it can't.
Is there a certain time of the month when it comes to the female cycle for them to start this product?
No, I mean, if you want to get into absolute timing, I would say I don't know that answer. But if somebody comes to me and, I just had somebody actually in our office whose daughter has such painful periods that she's missing school. Like, it's debilitating to her, and has just started this probably last month and is doing a lot better already. Now I'm excited to see what happens month 2 and month 3. But think about what this product does, right? It basically scrubs the receptors where those little xenoestrogens sit. Your estrogen can't get to those receptors because we're surrounded by BPA and all this crazy stuff. So how many kids today take their lunches in plastics? They're drinking out of plastic bottles. I mean, we're bombarded with all these xenoestrogens. Ester Cleanse is just good for everybody. It also can be used for men. My dad had high prostate numbers. I used this in our PSA, and he's down to normal. It's a thing, like, I can't go through every ingredient of every product we have. I was kind of highlighting the patented trademark because this is the stuff that you can go look up and find research on. Not generic, Google said this, but actually research patent ingredients, and lots of good information on it. What'd I do? Sorry. All right, so Thyro Complete, and I know that, we are constantly advancing with our formulations. You'll see things come and go, and you're probably like, why'd they stop doing that? Trust me, if we reformulate something, it's because we found something better, okay? This was a couple of years ago, obviously. This poor woman, again, what do you see on her? Red. Fiery, digestion everywhere, right? She came in with all of these things and was on so many medications that I was afraid of giving her anything with interaction. So I started super, super easy. Now, this was a step-by-step process. I started by just changing her diet. I put her on the Thyro Complete, the Adrenamax, and Super B Complete. I just wanted her to get some methylated B vitamins. I wanted to support the fight or flight that I could tell was all over her. I knew she had diagnosed thyroid. She had Hashimoto's. And then she also, was just super tired. I put her on a probiotic and GI Complete, and she went away. When she came back, she was feeling better, but she still had the anxiety. Instead of depression now, she kind of went to anxiety, so I got her on Calm Day and Sleep Time. And then, she had demonstrated some things with Candy Kill. But the funny thing was she didn't really lose weight till I put her on the Ester Cleanse, which I thought was interesting. And I had asked Jamie the other day, I'm like, is it possible that people lose weight on the Ester Cleanse? And he's like, well, yeah. He's like, if you balance hormones, that happens. And I was like, okay, so that would explain this. So these are all things like looking back now, when I had to do this lecture, I'm like, okay, what cases can I pull? What cases really stuck with me and why? And it really taught me as a practitioner to go in and learn these formulas and why they work. Because I know you guys just look at the label and you say, oh, Ester Cleanse, that clears estrogen, right? But when you know why it clears it and how it works in conjunction and the synergistic effect, it's a lot more powerful for you to be confident in giving it to somebody and them saying, well, you sure this will work? And you can say, yes, I am. There's proven research behind this product. You need to try it. It's awesome. Okay? All right, so here's my little personal testimony of my kid. I don't have pictures of him because I have 11,400 pictures on my phone and I couldn't find them. But let me tell you how much stress this caused me. Anybody know what molluscum is? This is going around rampant right now. You will see it, I promise you. Okay? This is a virus. It's heavily contagious. This is a mild case. Okay? These little pustules will become boils and get a heavy yellow head on them that you have to pop. So my 5-year-old had this, and he had it for 18 months total. Now, along with this, it's painful, it's embarrassing. He's 5, he'd go to school and his teacher would tell him, you're not gonna be able to come to school anymore like that. And he would come home crying. So as a mom, I was like beside myself. Like, nothing that I did worked. And I tell you, when I say I did everything, no, actually I did run around the house, chant, pray, anything. Like, I was like, hey, like nothing was working. So this is a mild case. This particular kid, his name is, I always get it wrong, Thayer. And Thayer had this. So by the time I got to this kid, I knew what to do. I was like, I know what to do. I know what to do. So we actually gave him a quarter of the Immunimax Chew every day, up to 3 times a day, as many as he would eat, and his molluscum cleared up in 3 weeks. Now my kid was not so lucky because obviously we learned from our mistakes. But I wanted to talk about this formula because it was the one thing that cleared him up, along with putting on the full spectrum hemp extract cream. I put that on him too, and it seemed to work. But the Mataki is really what makes it. It stimulates the immune system by enhancing the immune system through activation of the macrophages, T cells, and NK cells, right? Natural killer cells. The cool thing about our immune system is this. We have two pathways, right? Innate and adaptive. The innate is really pattern recognition. It's pretty cool. Before anything even gets into your body, for you to have a response to it, your body already knows what to do. And when I did the lecture with Sherry Tenpenny, when we were talking about vaccinations, the innate pathway isn't studied in vaccines because it's your natural identifier of good and evil. So even before you make an antibody against anything, these natural killer cells can be out killing things you don't even know that are in there through that innate pathway. It's amazing how the body's made. And that's where this actually works, on the innate pathway. So some of the studies that have been done with this particular Maitake diffraction is on cancer, tumors. I mean, you guys can look at all the studies on it, but reduced tumor size, apoptosis increased, natural killer cells increased. It's an extremely powerful combination, Immunomax, when you're approaching difficult cases like that. Okay? Don't discount this product, it's awesome. Okay? But for molluscum, which almost ruined my life, my kid did end up getting MRSA and staph. It just went into everything. It was terrible. And as we know, if you are on that path, the lymphatic system is so congested at that time. I mean, that's really the issue, is why we turn into things like that. So it was really a lymphatic issue with him. But this, giving him the Immunomax, just worked very fast and was the one thing that actually got it under control so that I could go back and get into the lymphatic system and go back and get in, to all the other things.
Tracy, can I make a quick comment?
Yeah, go ahead.
On the MRSA that she said her son tripped into after this, methicillin-resistant Staph aureus, it was spreading like wildfire about 5 years ago. A lot of sports teams had it. They had nothing to control it. They tried doxycycline a lot of different ways. A new study came out about 2 weeks ago about using organic CBD topically that actually knocked Staph aureus out within a week.
See, I didn't even know that.
So that's a newer report that just came out that says, in this case, you could actually use that topically on the same type of situation and knock it out. So if you're working with some sports teams and they run into that kind of an issue, it's highly, highly effective. New research piece being done on organic CBD just as an immune builder on its own. It's now found to be antifungal in the human body. So we're finding all kind of attributes to it. And the last thing on molluscum, I've had 2 cases in the last month of females with this vaginally.
Aye.
Okay.
That would be an awkward appointment.
Completely debilitating. And I'm treating both of them right now using this protocol, along with a high dose of the MTHFR support, and it seems to be working.
Wow. Yeah, and that's the thing. It's about finding the right combination. I mean, for my son, it was the topical cream. I didn't even know that, but it did work. And as a mom, I'm just like, oh my gosh, what do I have left? And I was just putting stuff on him, and all of a sudden I started to notice, like, oh wait, this is going away. Because we went past this stage into MRSA and staph, and it was just like, ugh, So anyway, mom stress. All right, so the cardiorespiratory, the CircuCore, this is actually an awesome formulation because of the quadrifolic. This is our patented completely stage 5 converted folate. So for people that have MTHFR and have the high homocysteine, this is a 677T. Okay, so for people that have the MTHFR mutation, you have to be careful what kind of B vitamins you give them. You have to be careful that they're not eating enriched white flour, as Dr. Len said. You have to be careful because if it's not a methylated form of B vitamins, it is poison to their system, literally. Okay? It will destroy the liver over time. So the quadrifolic is in our cardiorespiratory, our CircuCore. It's an amazing product that you can utilize for people that have heart issues of any kind. And it really does the job because it has this converted, already trademark patented ingredient. So when we look at MTHFR, this isn't anything that you're not going to come up against anymore. You can also use Super B Complete, which has that as well. But the 677T, that is associated with the high homocysteine. And when they have high homocysteine or a mutation, they can't make glutathione. So when you can't make glutathione, you're going to become toxic. If we had enough glutathione, if we had optimal levels, you could absolutely get rid of heavy metals in your body all by yourself. Wouldn't need anything else. But we don't live in a bubble, you know, and we have stress. Go ahead.
What product do you guys have that has glutathione in it? Because I know you don't sell just glutathione.
I actually like to use NAC and vitamin C over glutathione. This, I mean, to be honest with you, to know how much glutathione a person needs is a crapshoot. You don't know. But the NAC vitamin C combination is a precursor, and it'll actually create glutathione in the body, and it'll create it at the levels you need. Okay? So, I mean, I actually just started taking the NAC. Go ahead.
Yeah, that's what makes the DMG so unique. It feeds there's 41 transmethylation pathways.
Yeah.
All leading to glutathione, so depending on what a person's deficient,
Right.
they'll modulate over. So that's why we use that a lot. In the past, glutathione was a little tougher to absorb. Now some of the newer versions that are like liposomal and things like that. So we're all looking into it for next year.
Yeah.
But
It's awful. It's like, it smells like raw.
Yeah, it's
somehow
very
it's
sulfury.
dry.
Mhm. Yeah, so I like the NAC, but for kids, it's a little bit more difficult to give them the NAC, but I just break it open, I put it in something, and I give them a chewable vitamin C. Seems to work great. And kids tend to like that sour taste. I mean, how many of us had Sour Patch Kids? Just to be honest, guys, we had we ate them by the truckloads. So anyway, amazing products. I love, the CircuCore. This is something to look into. This is my timeline. I don't want to get into things. But again, we have the grapeseed extract with a high free radical, which is going to be due to your low glutathione because of the mutation or simply because you have cardiovascular issues. The Activin is going to be great to help clean up the free radical damage. And that's one of the things with heart disease that you're going to see is free radical damage. And so this is just a great benefit as well. All right, so Super K2 Plus, we reformulated this. We actually have the Vita MK7 in it now. This is an amazing product. I love Super K2 Plus. I use it for everything. I use it for when I'm getting sick, just in general. When we went through the PowerPoint with our developer, we were like, everybody in the world should be on this. Like, it's just an amazing product. It basically got its claim to fame with Weston A. Price. Does anybody remember that study? So Weston A. Price in 1945, he called it Activator X. And he went into non-industrialized countries and he realized they had better bone structure, better teeth. And this was actually the nutrient that was so abundant that kept them so healthy. And then you came back to the Americas, right, where we don't have K2. And so when we talk about cardiorespiratory, I consider a K2 like the mailman. He tells calcium where to go, right? He's the delivery system. So vitamin D tells calcium, hey, it's okay, come on into the blood. Calcium floats around, and vitamin K says, go into this bone, okay? If not, it'll go anywhere. It'll go in your kidneys and become stones. It'll go and become heel spurs. It'll be on your arteries and your veins, and you're gonna have some sort of issues cardiovascularly. So this is a great complement with the CircuCore to add in, because it's just a great place for calcium. We do not want it on our arteries and veins. Okay? The other thing I like for it is teeth. We're very teethy in my family. Obviously, you can tell. My son always tells him, Mr. Ed has nothing on you, buddy. You got some big teeth. But what happened with John, so this is John and this is Luke. Luke had the molluscum. John just has big teeth. But he was getting a ton of cavities, like a ton of cavities. And I was like, why are you getting so many cavities? So I started him on, at the time, what was called Super K2 Plus. And now we're all on the it was on K2 Plus, now we're on the Super K2 Plus. It's excellent for teeth. So good. It is one of the things that I'll tell my moms, above everything else, get your kid on K2. And we're deficient in it, right? We don't grass feed our cows. And even if we do, people are drinking homogenized, pasteurized, dead milk. It has no probiotics, no living K2. It has nothing in it. And how many kids do you know eating all their fruits and vegetables and grass-fed beef, right? They're eating Burger King and, you know, goldfish. So it was one of the things in my family that we did, and we haven't had a cavity in 3 years at all. So we're very teethy. All right, this was one of the things that kind of established my practice with the Amish. I got an entire Amish community as clients. When I helped a 90, I think she was around 90 some, let me see, I can't remember how I have it written down. Nope, I didn't write it down. 93 or 94-year-old grandma. She came in with reoccurring bladder infections and kidney stones. And I was like, oh, okay. I was like, well, I know you have a K2 deficiency because you have kidney stones and they're calcium based. I was like, but what about the bladder, right? So obviously I used our UT cleanse that has the D-mannose. You know, just so many awesome things with D-mannose. I mean, I think we know, but it's really about understanding the products and how to combine them for the best powerful punch that we can get. And when I combined this UT cleanse with Super K2 Plus, not only did it fix up her bladder infection like instantly, also, I love that it's a powder. How many 90-some-year-old women do you know are dehydrated, not drinking enough water? So this forced her to drink water and get the D-mannose and the Fibrosol, which helps with all kinds of microflora. And then I added this, and we didn't have any kidney stones reoccurring. And then all of a sudden, I had 3 entire Amish families in my waiting room the next day. I walked out, I was like, oh, hi. I was like, my, there's a lot of you. So that's basically what happened. And they all pay cash, by the way, just letting you know. So it was great, but that's kind of what started it. So if I wouldn't have known how to combine those ingredients to be like, oh yeah, this is because of this and this is because of this, I may not have had the success. To date, she's never had another bladder infection. She stays on this product, not all the time, but I tell her every couple months you need to take this. And that's something you have to remind your clients. It's not just like take it till you're done. You know that she's not going to go back and eat foundationally. Like she's not going to drink her water. She's 90-some years old. But she will remember to take UT Cleanse once in a while, but she always stays on K2+. Okay? Also with bone density, guys, Super K2 is an amazing thing. It tells calcium to get into the bones. You have your clients and patients with osteoporosis, Super K2+ is an absolute must. Okay? So, remember how Jamie was saying, we talked about this formula a lot. One of the suggestions that came up was that we add this little product called sustamine into our glutamine. And I want to point this out. Right now, this is in production. And what we did when I came in and Jamie and I had a talk with, Len, who helps us formulate everybody, what we did was slow down production on our products. Not only do we want to provide you with the best products on the market, but we want to know why they work and at what levels we need to add what in. So we slowed down a lot of product development, and in 220 you're going to see some cool launches. This is one that's in consideration. It doesn't mean that it's going to actually be, but there's products like this on the market that have this ingredient in it. But I challenge you to find out how much is actually in there, right? Because they won't tell you on the label. They can literally put this on the label if they sprinkle it in there, right? But that's not how much therapeutically will drive the actual glutamine into the intestines. And I think if you get the right therapeutic levels, which is what we're studying right now, then you can have an amazing product that's more effective by, 20%? 20%, something like that. So what they found with the sustamine was that the straight glutamine, both peak increase, it was shown higher in the blood plasma and also longer. So we're looking at this now to make our products more effective. It's something that we're considering. So just watch for that in 220. And just to know why we reformulate or why we try to do a little bit better. It's never because we don't think a product's working well, but science advances so fast, health advances so fast, and we are just trying to stay ahead of that. Okay? But like Len was saying, if you have suggestions, you have products you like, we love feedback. We love for practitioners to give us ideas because you're in the field. You're vetting what we're creating. We don't just come up with stuff. Like, let's see, it's Thyroid Tuesday. It's like, we want to make sure that we're producing products that will work for you, that give you those patient enhancement products, and also increase your practice profits. Yeah. We love to hear from you. So This one was probably my simplest case ever. This girl came in, she was overweight, unhappy, and I thought, well, it was absolutely digestion. I changed her diet, gave her GI Complete, Superbiotic, Super Shake, and Frontier Multi, and I sent her out the door. I usually turn my clients around in 3 weeks. That was usually my average. 3 weeks later, 10 o'clock, I knew she was coming in. I walk out in the lobby and I'm looking for her. She's not there. There's a couple people waiting. Go back in my office, come back out, and I'm like, it's just not like her to be late. And I walk back out, and this girl's waving to me. And I'm like, hi, yeah, okay, nice to see you, yeah. So I'm like, I walk over and I was like, can I help you? And she's like, yeah, I'm here for my appointment. And I'm like, well, what time you scheduled? She's like, now. And I'm like, who are you? And she told me her name. 3 weeks. She lost 28 pounds. 3 weeks. I didn't even recognize her. I was like, oh my gosh, I'm that. So sometimes it's real simple. Sometimes if you just give people nutrition and fix their gut a little bit, they lose weight. It's pretty amazing. I didn't even recognize her. She was so happy. Look how cute she is. She was so happy. Now, we kept going on with her program, but I'm just letting you guys know, like, sometimes it's complicated, and sometimes it's really simple, okay?
Tracy, did you increase any of the dose on those, or was it just
No, it's just a protocol. Like, she was at that point where she just, had tried everything, and that was her last hope, so. And, we had like a budget to work with, but I said, replace 1 meal a day with Super Shake, take this once a day, probiotics at night, and I went on and on. So this is the new edition of Holistic Truth. It's a workbook. I challenge everybody in here to get it and actually do it. Change your life a little bit. This is, like I said, how I practice. I wrote these magazines for this year with help of our team. So it's a great little guide. And then obviously, one of your own from Florida. We're going to bring her to Pittsburgh in November because we thought that was funny. So this is Dr. Brasilia. She's amazing from the Brasilia Med Spa, but she's going to be going over breaking the silence on women's health. And although this is in Pittsburgh, you can still get it by live stream. We'll be live streaming this one or get the playback. She's amazing with women's health and hormones. So it's something to see. And she's from this area. So she's from Tampa, is that right? Where's she from? Boca. She's from Boca. So do you guys have any questions for us? You can sign up for this online under the events tab on our website.
So this is basically a checklist you should use before you buy CBD. Now, we stood on the sidelines about 18 months before we brought this out. About 18 months ago, we decided to pull the trigger because I've looked through many sources. So a couple things, right? First of all, ours is full spectrum. What that means is we put together a jigsaw puzzle. CBD is a big part of the puzzle, but only one piece. There's 122 pieces to the puzzle. So if it's not full spectrum and it's isolate, you only get the CBD. And the isolate, isolated, you have to use chemicals. We don't use chemicals. So we use the full plant, which is CBD plus 122 phytocannabinoids. Ours is all grown in the U.S. on organic farms. Most CBD, as I learned from the show last year, come from Mexico or China. And if you know a lot about the hemp plant, it is actually used in some fields to pull radiation and metals out. So you don't want it from Mexico or China. Next, it's single source. It's us and the grower actually is the manufacturer. So it's us and them. There's no brokers, no middlemen, no third party. It's us and them direct, transparent. Next is supercritical. So we use high pressure gas to extract it out of the plant. No chemicals going in, no chemicals coming out. Right? All CO2.
Carbon dioxide.
Yeah. So no chemicals, solvents, herbicides, or pesticides, completely free. And we do the extra step of distillation, just like our fish oils, to reduce some of the odor, small particles, and make it pure and cleaner. I've rarely seen companies doing that. And then you look at quality, USDA certified organic. What I saw recently was Hemp Authority certified. So I don't know what that means. I'll send it out to a third party independent lab that only gets paid to test. They don't care if it passes or fails. And all this is on our website. If you want copies, we can send you whatever you need. And then you get down to the bottom, we have it organic, and we've got many different deliveries, 4 flavors, 3 sizes of liquid. We also have the gummies, and we have the creams, plus the soft gel with curcumin in it. The liquid right now, want some water? The liquid right now has gone through the USDA organic certification. The Lipoderm uses the same ingredient. However, with the Lipoderm, it's not 100% organic, but the CBD in there is. The soft gel and the gummies got to go through some more processing. But once you have a patient start to go through this, they're not going to get real far. Even when you're purchasing, we want you to purchase ours, but at least if you're purchasing someone, ask these questions. If they don't know or try and tell you isolate's better, it's not. One last caveat. If they tell you it's THC free, it's not true. It's low in THC. All it has to be 0.3% or less. The only issue for me is somebody being drug tested. Truck driver like my brother and my nephew, teacher, and cops. Usually those are the ones. If they're getting drug tested, do not have them take any CBD from any company. We third-party tested about 10 different companies, and at the beginning we were telling people they'll pass the test, they won't. So now we tell them if you're getting drug tested, or have your doctor write a letter. Some companies are okay with that. So if they are getting tested, do not have many, or write the letter for them. They all have trace amounts of THC. Plus nowadays, I don't know what people are doing in their personal life, your body stores the THC in fat cells. So if they're breaking down fat, this can come out from years ago. I know Len's had some patients that did, failed drug tests. So if they're taking it, no. If somebody's telling you that theirs is 100% THC free, it's not correct. That's just from all of our testing and our experience. Plus, we're not a CBD company. I know it's hard to believe I look so young, right? But I've been doing this for almost, another one of my bad jokes. So. I've been doing this about 30 years. And our company, Nutritional Frontiers, will be 12 years old in May. So we've been around a long time. We're not just a CBD company that popped up out of nowhere. So we created this because we get so many questions on it. It's so confusing. But this is a very simple way. People will fall off as soon as you start going down this list. And we make it all the way through. There's only 1 or 2 I went to the Baltimore show, the health food show in Baltimore, Maryland, a couple weeks ago. It's the biggest one on the East Coast. There was hundreds of CBD companies there. Only 2 had USDA organic on their booths. 2. So it's about 1% of the companies right now. So we can provide these for you in your office. We have nice framed posters. Just let Rashid or the office know.